Okay, now we are talking about VC SIMV mode, that is volume control, synchronized intermittent mandatory ventilation. These are the 12 breaths we have set, with the ventilator will be providing mechanical breath. PEEP, this is the IE ratio, tidal volume, FiO2, this is the slope we have decided to choose, this is the flow. Now I want to show you that what is the trigger, where we have the trigger here. Let me show you. We have trigger in the additional settings. We have trigger here, additional settings. Yeah, we have touched that button and we got this option, that is flow trigger. It is set at 5, so we can also decrease it. Like I will take it to, let's say, even we can 0.2, I will take it to 0.5. So it's up to you. You can keep it minimum. What it means? It means that when the patient has initiated a breath with the minimal effort, with the minimal tidal volume or the minimal flow, the ventilator will sense it immediately and it will support the patient's breath. And when we set it higher level, and what happens when we set it to a higher level? Like usually we set it on the 5. In simple words, it means that we are setting it on a higher level so that if patient is not taking an adequate breath with an adequate tidal volume or pressure, the ventilator will not pick it. The ventilator will not identify that breath and it will continue to give its mechanical breaths. Ventilator's breaths will be dominating, although it will allow the patient to breathe, but it will not support the patient's breath. But when we decrease it to a lower level, what happens here? Over here, in this setting, when the patient is taking the minimal breath, patient is showing the minimal effort, the ventilator will pick that and ventilator will support that breath. It's simple as that. I will try to demonstrate it. What I will do here, I will try to mimic a patient's breath by pressing my dummy lung, and we will see how it changes, or would it change anything or not. Now these are the mechanical breaths because patient is paralyzed or whatsoever, patient is sedated. Let's say our patient is sedated and suddenly patient start taking breaths. Our trigger was on 6. So now the sensor of the ventilator will not identify, or it will not pick the minute breathing effects of the patient, and it will continue to give its mechanical ventilation as we have already set all these settings. We have done with settings. Now I will try to mimic the patient's breath by compressing this bag here. Let me try. Let's see if it makes any difference or not. Although the patient's breath will be negative and it should go down here, it will be like this. If the patient will take his breath, it will go down like this. There will be a change, it will go down like this. Over here, it will go down like this. So we cannot mimic patient's breath. But let me try. I'm just compressing it and it didn't bother at all, and it's continued to give its own breaths. The advantage of this mode is that it won't stalk the patient's breath. So it will let the patient breathe and it will continue to give its own breaths, but it will not support the patient's breath. You got my point? This mode will let the patient breathe, but it will not support it unless we set the trigger to the lower levels. Like we set it to a lower level, we'll go down 0.8 and now after setting it to a lower level, now the ventilator will not only let the patient breathe, but it will also support the patient breath. So this is trigger. I hope you got my point. Let me try it. You see here? Okay, let me do it again. I will compress my dummy lung and it will show, and the ventilator will pick that effort, the minor effort, and it will support it. Let me show you. You see here, I'm trying, and it not only let the patient breathe, but it's trying to support the breath. Can you see here? It's trying to support the breath.